Welcome back here to Fox 51 today. Prostate cancer is the second leading cause of cancer-related deaths among men, primarily affecting men who are over the age of 50. Now, the American Cancer Society estimated back in 2012 more than 241,000 men were diagnosed with prostate cancer, and more than 28,000 men will die from this disease. In an effort to educate the public, September is recognized as National Prostate Cancer Awareness Month. And joining us now to talk more about this is Dr. Andrew Kirkpatrick, a urologist with Trinity Mother Frances Hospitals and Clinics. Dr. Kirkpatrick, great to have you here. Thanks for coming in.
Good morning, Ben. Thanks.
So let's start with prostate cancer. First of all, can you explain exactly what prostate cancer is and the risks that come along with not being screened regularly?
Sure. Prostate cancer is just is a cancer of the prostate gland, a gland that lives right in front of the bladder. It's a common disease in men. If we live long enough as men, we all get prostate cancer. It's just a matter of when.
Oh, really? Okay. So, well, now, when should men actually start getting screened, and how often do these screenings need to occur?
Well, there's been a big controversy as far as screening recently in the press. The AUA, our association, has recommendations now, and we're targeting screening now to an age group of 55 to 69. And that's the best age group to focus on for screening efforts.
As far as cancer in men, where does prostate cancer kind of rank amongst the most likely to be diagnosed with?
Well, it's the number one non-skin cancer in men.
So these screenings, once they take place, these new guidelines into effect, what exactly takes place at these screenings? If we can go into some detail here with being understanding that it's a family show.
Absolutely. What it requires is a blood test called a PSA, prostate-specific antigen, and an exam of the prostate. Mm-hmm. And those are the two main parameters for screening for prostate cancer.
Are there any things during, for instance, urination or even ejaculation that men would notice different from their normal habits, and that would lead to getting a screening?
It's possible. You know, those may be symptoms of just enlarged prostate, but they also could be a symptom or a sign of having prostate cancer. So those are symptoms and signs that you might want to talk to your doctor about.
Well, let's talk about treatment options, Dr. Kirkpatrick. If you are diagnosed, where do you start? And I'm sure diagnoses, are different for different people, but what's your first recommendation?
Well, it starts with a prostate biopsy to diagnose the prostate cancer, and then there's several treatment options, and it really boils down to maybe watchful waiting for certain age groups, maybe surgery, maybe radiation.
But you're acting like this is pretty much an inevitable thing for all men out there. It's just a matter of getting screened, and I'm assuming, as with skin cancer, which you mentioned, it's catching it early, which is probably the most important thing, correct?
Right, and it's most important to talk with your physician to figure out exactly if you're a candidate for screening or not.
And let's talk about the genetic nature of prostate cancer. How does that factor in?
We probably think it's genetic. If your father or brother had prostate cancer, you're more likely to have prostate cancer, although, like I said before, all men, if we live long enough, are designed to get prostate cancer.
Because you say more likely, but even if your father or grandfather did not have prostate cancer, doesn't necessarily mean you're free to not get screened,
right? That's exactly right.
Okay. Where's the best place to learn some more information about prostate cancer, even have, your wife or, family members look over it as well?
We recommend going to our website, tmfhs.org, or American Cancer Society website. MD Anderson has a good website.
And if they'd like to set up maybe a consultation, for instance, if they're in that 55 to 69 range or something and feel like they want to get screened a little more heavily, how can they set up an appointment with your staff?
They can just call our office.
Okay, wonderful. Dr. Kirkpatrick, thank you for the great information today. We appreciate you swinging by here to see us this morning.
Thank you very much.